Okay, we are live, I think. Hello. Thanks for joining, anyone who is joining. If you have just joined, do let me know in the comments so that I know I'm not just talking to myself and that people are out there. I will give it just a few minutes for people to join. I can see we've got a few joining now, which is great. Hello. So welcome to this Q&A on stress reduction in the veterinary practice. Please do comment to say hello. Let me know whether you are a veterinary professional, whether you are a owner, a pet professional, be it a behaviourist, trainer, dog walker, groomer. Do let me know and say hi, and we will get going shortly. We'll just give it a little bit longer for people to join. So hopefully you can see me and hear me okay. For anyone that knows me, I'm a little bit rubbish with tech, so I've got my laptop up to have a look at the comments coming through and to check for any questions, but yeah, do let me know if I'm missing one. I'll try and get through the questions as much as I can. So whilst we wait for the questions to come through, hello everyone. I'm just going to give you a quick intro to myself first of all. So my name is Charlie, for those of you that don't know. I'm a registered veterinary nurse and I've been in practice for well over a decade. Recently left practice to take on an exciting role in education, so teaching veterinary nurse students. So I spend my days supporting veterinary nurse students at Harper Adams University, which is fab. So taking a bit of a step back from veterinary practice. But outside of that, I also run my own behaviour and training business. So I see clients for training behaviour. I'm a full member of PACT, a animal training instructor on the Animal Behaviour and Training Council, and I'm a proud provisional member of the APBC. So with that in mind, I of course love anything related to stress reduction within the veterinary practice. I've had lots of experience in the subject and hopefully be able to share some of my insights with you this evening. So I don't think we've got any comments, we've got plenty of comments. I don't think we've got any specific questions just yet, but I will keep an eye on them. I'm going to sort of just get the ball rolling, as I think we've got quite a few people watching and commenting, and then feel free to just jump in and ask any questions. This talk is primarily aimed at veterinary professionals, so the vet team, but more than welcome to jump in and ask questions if you are pet owner, pet professional. Please do just let me know, if you are an owner, pet professional, veterinary professional, and I will try and tailor my answers so that everyone can relate. Okay. So the idea really is just to, as I said, give you a bit of, give you some tips really on how to help reduce pet stress within the veterinary practice. Obviously the veterinary practice can be quite a scary place for pets. Just having a little look at the comments now, just make sure I'm not missing any. No, that's fine. Okay. So as I said, it can be quite a stressful environment for pets, for pet owners, for veterinary professionals themselves. It's quite a strange environment for most pets, particularly if they've not been to a vet's before. You may well get pets that are coming in that have never been to a practice before, that everything's novel to them and it's sensory overload, with all these smells, sounds, sights. And then you get pets that just come in for their yearly checks, their yearly boosters, and whilst they only come in for that now, we're still taking that choice away from them. We're still putting them in a strange environment and removing choice. And then you get the pets that come in when they're poorly, when they're painful, and they're going to be in a negative emotional state. They're going to form potentially a negative association to the environment. So there's lots of things that we as veterinary professionals can do, and the wider team, as well as pets. And after all, it is a collaborative approach. So let's just have a little look to see what questions we've got first. So Kerry, a vet in, oh, you've gone. Let me just try and get you up on the laptop because my phone is not playing. Okay, Kerry, thank you for your question. So, vet in the US, what are your best strategies on reducing stress when seeing 2 or more cats in one appointment? Yeah, so I'm going to try and relate this to cats and dogs and all patients really, but I do have a tendency to sort of steer back to dogs. So do let me know if I start doing that. But yeah, just as important for cats as well in reducing their stress. So best strategy for reducing stress when seeing 2 or more cats in one appointment. So I'm assuming, Kerry, that is from the same caregiver, the same owner. And I think with most stress reduction strategies I'm going to give you this evening, it comes down to client communication. So we need to be taking a bit of a history about those 2 cats. So first of all, are they, do they have a bond? Are they a bonded pair? And why are they coming in together? Do they need to come in together if they're not bonded? Are they in the same carrier? Are they in separate carriers? Ideally, we want them in separate carriers. So there's lots of things that we can be doing sort of to communicate with the owner before we actually get them to that appointment. Often we'll just get appointments, sort of see them as they come really, and we have to deal with the situation that we've got there. So trying to give them choice with cats as much as possible, so choice to retreat, choice to feel in control. And if they're not bonded pair, keeping them separate, keeping them in separate carriers, doing one at a time, going quite slow with them, making sure we clean down and remove that scent in between. So it really does depend on if they are bonded or not, I guess, my answer would be for that one. But I think the key is just to get that information from the owner first. So, conversation is everything. We can be getting a lot of this information when they first book in. So first port of call is to get the receptionist to question the owner. Are they bonded? Are they going to be coming in together? Are they coming in separate carriers? Do they need to come in together? And go from there really with our approach. So I hope that kind of answers your question. Okay, so we've got Michelle. Hi Michelle. Tried to set up fear-free consults. So Michelle tried to set up fear-free consults before, but found clients reluctant to join them. Any tips on how to get them on board? See, there's probably going to be a little bit of a theme going on here. So sometimes half the battle with reducing a pet's stress is to get the client on board. One of my colleagues mentioned this to me a few days ago actually. And it is something that I think we struggle with anything that we're doing in practice. Be it just preventative care for puppies, kittens, or when you're trying to treat a condition or advise on a condition, it's client compliance that we rely on ultimately. So it's all very well setting up these stress reduction methods, but getting clients on board is sometimes a different challenge. Now, any pet owner that's going to be watching this evening are the type of pet owners that will be on board, that will be encouraged and keen to do that for their pet, but not everyone sees the relevance. So it does come down to opening up that conversation. So, identifying and recognizing when a pet is stressed, they may not realise that their pet is even stressed. You know, we as veterinary professionals will see body language, we'll be able to recognise body language, and even just the subtle cues that our patients give us, we'll be able to have an idea of potentially their emotional state at the time, where they're experiencing acute stress. But that's not, we shouldn't assume that's the same for pet owners, particularly if they are just showing those really, really subtle signs. So I think, first of all, taking the opportunity to identify when they are showing that they're stressed. So if we've got a dog that's in for the booster that's yawning away, or a cat that's come in for a weigh and worm that's clearly trying to scramble into its carrier, then pointing that out to owners, to clients, and having that conversation about why they might be doing that, what's the motivation behind that behaviour, what they might be feeling. And that opens up that conversation then to provide that education. So to provide education on body language, how they can better read their pet. Often I find that you explain a particular body language to a client. So for instance, you explain what yawning means and why they're yawning, and that they've not even noticed that the dog yawns, and they get home and start noticing that in different contexts, and then having a think about what that means in that particular context, and come back to you and think, and then sort of discuss, well, actually, yes, my dog was showing this sign in this particular context, and yeah, I noticed that he does do it when he comes to the vets a lot. So that's I think the first thing is just to get them to read their pets, to read their body language, educate them. There's loads of resources that are out there, both on the APPC website. There's lots of information for clients out there, and for veterinary professionals. But there's also the ladder of regression that we can, show to clients that will demonstrate the subtle signs of stress for them. But once they know that their pet is stressed, we then have the challenge of helping them understand that it's important that we address that. So you'll probably get clients that will just bring their pet in for a booster that's clearly stressed, that's clearly not coping well in the veterinary environment, but because it's in once a year, we just let that happen, and we forget about it for a year and don't do anything for a year, and each year it gets a little bit worse. So I guess it's, again, having that conversation to explain to owners that it is potentially going to get worse each time, and actually, whilst we're seeing this pet yearly at the moment, whilst they're a young, healthy pet, in a few years they're going to be coming in regularly, they're going to be coming in when they're feeling poorly, they're going to need to be able to cope better and to be less stressed when they come in. So it goes back to owner education, I'm afraid, and that's really how you get them on board. I think with anything that we do is we need to educate them in order for them to be on board, and without that they won't. So sometimes providing them with one free clinic to just introduce that concept and to have that time to talk about that will be enough. Sometimes resources will be enough. It will be very much client dependent. So I hope that helps, Michelle, and thank you for your comment. Okay, so what else have we got here? Sally. Lots of info on cat friendly practice, but where to look specifically for dog friendliness. I believe I might be able to, other colleagues might be able to help me out here, but I believe there is a dog friendly scheme coming out as well, or that has come out. But I don't know enough about it to comment, but there is also a dog friendly scheme out there now. So hopefully that will be a bit more widely known and widely used. Any of my colleagues out there that do know about the dog friendly scheme, do please comment, and if not, I will find the information and let you know afterwards, Sally. But I believe there is a sort of equivalent for dogs as well. But you're right, we've done really, really well with cat friendly stuff, could always be better, but we're getting there. But not so much for dog specific friendliness. Certainly not in the UK anyway. Okay, and Pilar, thank you for your comment. Hello. As a student vet nurse, what should I do if a vet is stressing the patient out without intending to? Fab. Yeah, so thanks for the question there. It is hard in veterinary practice. I know that, you know, we are pushed for time, and we have quite a pressured job, and sometimes unintentionally we can, just by the nature of our job, we can stress the patients out by what we need to do. But that's really good by, you know, for having two people working with a patient. You've got potentially the nurse or the vet having a look at the body language whilst the other person administers treatment. So yeah, if you do recognise that the patient is really, really looking stressed, just open up that communication with your colleague. Hopefully you feel comfortable enough to do that with your colleagues. So by just saying, you know, maybe let's just give him a little bit of a break. He's showing X, Y, and Z signs. You know, he's doing this, this, and this. He's clearly a little bit stressed, and we're not getting anywhere. Can we just give him a couple of minutes break? Let him have a little bit of a sniff. Let go of him. Let him chill out for a little bit, and then come back. It's also having that conversation of how urgent is whatever we're doing at that point. So, you know, is it a case of emergency treatment that the vet's administering, or is it something that could be put on hold? And that is really up to the, you know, the decision of the vet, really. But if you've made your opinion known and you've commented on the dog's body language, the cat's body language, then at least you've opened up that conversation, and you can then, you know, make a decision together about whether to carry on or not, depending on the need of that treatment at the time. It might be that your colleague has not even noticed because they're trying to do what they need to do, and they're not able to keep an eye on the body language as well. So being their eyes is really, really useful, and they'll probably, more often than not, actually appreciate that insight into the body language, and ultimately it's going to be for their safety as well. So I think be brave and communicate with each other. See, there's a theme. Communication is definitely the theme this evening. Okay, just see if we've got any more. Kerry, what is your experience? Hi Kerry. What is your experience with advising behavioural meds to help facilitate vet visits, and in what cases would you advise these to be administered? So, So, as a non-vet, I can't advise behavioural medicine. So that would be something for the vet to do, or veterinary behaviourists to do. So it's not something that I can comment on. There is, however, if you're wanting information for your vet colleagues for this, then there is information on the APBC website on behavioural medicine. So there is the information out there, and there's also veterinary behaviourists that can advise on that. So I'm sorry I can't answer your question, Kerry, but thank you for saying hello and commenting. I'll just see if we've got any more. Okay, so I don't think we've got any more questions, so I'll just start chatting away if we haven't. Oh, hi from Denmark. Fantastic. I think we've got a bit of a delay between my computer and my my phone. So I'm just checking on here that we've not got any more questions that I've missed. No, don't think so. Where to find good resources on environmental enrichment for hospitalised patients? Oh, that's a lovely question. Thanks, Sally. I don't know of any specific resources, actually. I think there are a few studies out there on general enrichment, not necessarily for hospitalised patients, but general enrichment can maybe be applied to hospitalised patients. There's certainly a few tips that I can give you this evening. So It depends on obviously the case that you've got, their needs, their dietary needs, you know, their medical needs. But yeah, enrichment is often a thing that can be neglected for hospitalised patients. So when we talk about enrichment, it should be that we are enriching their experience, but actually just by providing some mental stimulation by the way of if they know, if they're well enough to work, if they know tricks, so getting that information from the owner as if they are really good at a certain trick, so giving a paw or waving or sitting or hand targeting, then provide, and they enjoy it and they're comfortable enough to do that, then just spending a little bit of time with them, getting them to do a few different tricks to keep their mind occupied, to build that bond. Obviously, if they're stressed, they potentially wouldn't be wanting to do that. But assuming that the patient is quite content and we just want to provide that mental stimulation, then yeah, getting them to do tricks that they know will be really, really nice for them. Food, so the stuffed Kongs, licky mats, even like a snuffle mat, things like that. So a lot of it's going to be food based. But spending some time with them outside as well, getting them to do, if they're able to get outside on their own, they're able to walk about and they're able to sniff, then doing a little bit of scent work with them. So popping some of their food in the grass. Obviously we don't want to overdo it with our patients because they are healing, they are recovering, so it is really patient dependent, but that can be part of your plan, sort of as part of your care plan to implement some environmental enrichment. Yeah, absolutely. If anyone else has any good ideas on things that they've done or they've experienced with that, then please do let us know. But it's usually food-based play, spending a bit of time with them, really. And ensuring that they are, I think the key is ensuring that they are not stressed. So there's no point trying to enrich them or provide them with mental stimulation if they're actually not coping in the first place. So I think we'd need to get that stress down first. So if they are stressed, considering what can we do to reduce that stress? Is it a case of a comfier bed, covering their kennel, moving them into a different kennel or a different ward, popping some music on, using pheromones, or having some time with them outside? So what can we do to reduce that stress first so that they're in a positive emotional state before then implementing mental stimulation enrichment? Okay, I'm going to try and keep looking at the questions on my phone because they seem to be coming in better than on my computer. So Clarissa said, thoughts on when a vet won't let a customer come into the appointment. So vet won't let customer come into the appointment. So I assume that's for COVID reasons, is it, Clarissa? So, or is it a specific, is it for a behaviour reason? Is it that the dog, cat is deemed to cope better without the customer? I think I'd want to know the reason behind it. So, again, open that communication channel with the vet and question, well, why is that the case? Why can't they be there? Certainly if it helps the pet for them to be there, then I'd want them there. I would say that generally in most practices now, we're seeing clients back in the consult room now, so I can't imagine that being a reason. But yeah, I think I'd want to know the reason and question it, really. And if it's not for the best interest of the patient, then I'd want to potentially challenge that in obviously a very constructive and open way, perhaps after the appointment, if it's a bit too late at that point. Okay. So studies show that, so Clarissa's replied, studies show that owners can provide a secure base to dogs, reducing stress, but the vets often try to take them out the back, away from the owner, to secure it. Yeah, right, okay, I understand now what you're saying, Clarissa. So the whole, I'm just going to take them out the back to see how we get on. There are instances where owners are so worked up that they do have a negative effect on their pet. So, you know, there are occasions that it can be helpful for the owner not to be there, but we would need some sort of reassurance in place, I would say, of the owner. So be it an extra person to reassure, and we'd still want to be doing absolutely everything we can to try and reduce that patient's stress. What we don't want to be doing is just taking them out the back because it's more convenient and we don't have to apply the stress reduction methods. We don't have to be, calm and gentle with our approach. So, yeah, I think that the take them out the back thing is definitely something that used to happen a lot and happens less now. But there is still, I hate the phrase of it really, but it still happens. But I think it needs to. If we're not having the owner there, it needs to be for the right reason, and I would say the only reason really is if the pet is getting more worked up with the owner there, or if it's an emergency situation, of course, and we just need to rush that patient through without the owner being there and getting stressed. So more often than not, I'd want, where possible, I want the owners there. So if you do have a situation where or even as an owner, you want to be there and you're not able to, then find out why. It's kind of come back to to why with everything really. I mean, why is it being done? Is there a good reason for it? And if there's not, then challenge that. I hope that helps, Clarissa. Okay, just trying to refresh this to see if we've got any more. Gosh, it's almost 30 minutes. So I think what I'll do is just do a little bit of a summary. If no one's got any questions, any other questions, I'm sorry if I've missed any. If I have missed any, I will try and comment directly to you. So yeah, please do continue to pop questions in and I'll try and answer them, but time has just flown by. Ultimately, the message that I want to get across, I could talk about this topic all day and all night, but the message that I want to get across is that in order to get to the point where we can reduce stress, so we can apply stress reduction methods, be it as we set out our waiting room in a certain way, we provide certain services such as confidence clinics or puppy parties, preschool, however you term it, practice tours before neutering, certain clinics, that sort of first aid clinics, whatever we're implementing, as Michelle noted earlier, we need to be able to get the clients on board with that. So before we get to that point, we need to be identifying, recognising the signs of stress, communicating with owners, with wider pet professionals, so the groomers, walkers, trainers, doing it as a collaborative approach and providing that education to them so that we can then get them on board to make positive changes. Because the onus is not just on the veterinary team. A lot happens before the vet visit. So we've got popping the pets in the car and travelling to the clinic, and then we've got getting out the car and seeing a big barky dog, or going through the clinic with lots of busy children. So there's all these triggers that can be contributing to that patient's stress, which is why we can talk to the owner, find out what's going on, what can they be doing to better prepare for the visit, to change the process slightly, be it getting a trainer or behaviourist involved with car travel or with harness training, and then we can adapt our approach. So we can change our environment, we can take a bit more time, we can offer these services, such as the ones that I've mentioned there, and hopefully it will all come together. So I would love to talk about this more. I'm happy to answer any more questions on the comments, and do another one on specific services that can be offered as part of stress reduction within the practice. But for now, I hope that has been useful, and it's something that you can take away to mull over and start implementing in practice. Thanks for joining, and I will speak to you soon.